Bell's palsy or idiopathic facial paralysis. Introduction to the Bell's palsy is known as idiopathic facial paralysis IFP. Idiopathic means it has no known cause. It's unilateral paralysis of facial muscles due to the facial nerve paralysis, that is cranial nerve 7. Most common cause of unilateral paralysis of the face, that is 60 to 75% of the cases, commonly seen at the age of 40. Scottish neurophysiologist Sir Charles Bell read his paper to the Royal Society of London on July 12, 1821, approximately 200 years back. He became the first to detail the neuroanatomical basis of facial paralysis. Since then, IFP has been referred to as Bell's palsy, that is named after him. Coming into the causes of Bell's palsy, the most common cause is nothing but the reactivation of viruses or new infection of the viruses. HSV1, that is herpes simplex virus, is said to be the one of the cause for the Bell's palsy or reactivation of the herpes zoster virus, Epstein-Barr virus, cytomegalovirus, and HIV, human immunodeficiency virus, and nowadays is known as reactivation of the SARS-CoV-2, that is COVID, is said to be the one of the cause. And sometimes even certain vaccinations also cause the reactivation of some viruses or trigger the viruses. So that is becoming the cause for Bell's palsy. And some bacterial infections like mycoplasma or syphilis is causing the inflammation of the facial nerve and causes the Bell's palsy. And some autoimmune disorders are causing the inflammation of the cranial nerves are resulting into the Bell's palsy. Risk factors for Bell's palsy or triggering factors for Bell's palsy are old age, diabetes mellitus, pregnancy, overweight, hypertension, and family histories. These are the risk factors for Bell's palsy, whereas triggering factors are cold wind exposure and viral prodrome. Cold wind because the facial nerves runs very near to the acoustic canal, ear canal. So cold wind exposure causes irritation to the facial nerve, resulting into inflammation of the facial nerve. And viral prodrome, certain viruses are grown on the certain periods. So such kind of seasons will affect the Bell's palsy. So these are the triggering factors for Bell's palsy. Coming into the pathophysiology of the facial palsy, see, when we look into the facial nerve, it has mainly 5 branches, that is temporal, zygomatic, buccal, mandibular, and cervical. So irritation at the root of the facial nerve or inflammation, ischemia, edema, compression of the facial nerve by any cause will affect these areas. So weakness or laxity of the facial muscles is seen. So any kind of ischemia, edema, demyelination of the facial nerve or compression by any growth or bony growth, soft tissue growth near to the root of the facial nerve, So that leads into the Bell's palsy. Coming to the signs and symptoms of Bell's palsy. So as I told, is a unilateral facial paralysis. Acute onset will be there. Upper and lower facial muscle weakness will be there because the temporal branch will supply to the upper part of the face, whereas mandibular part branch will supply to the lower part of the face. So upper and lower facial muscles weakness will be there. Impaired eye closing on affected side. So patient will not be able to close completely. That is will leads into the dry eye syndrome. Common on right side. That is 60% patients of facial palsy get affected on the right side of the face. Some other symptoms like ocular pain, otalgia, pain in the ear region, blurred vision, excessive tearing, that is because of patient will not able to close the eye completely because of continuous exposure to the wind, eye get dried. To overcome that problem, so there will be excessive tearing, decreased salivation, and hypercosis. Diagnosis of Bell's palsy is moreover the clinical diagnosis. No specific diagnostic test is available to diagnose the Bell's palsy. It's purely based on the clinical examination. Eyes, ear, mouth are deviated one side. Eyes will not be able to close completely. Ear, so there is won't be any acoustic reflexes, and mouth is deviated on the affected side. Stapedial reflex may be absent. That is nothing but the acoustic reflex is an involuntary muscle contraction that occur in the middle ear in response to the loud sound stimuli or when the person starts to vocalize. So that is absent here. And squamous chest. So this is used to determine whether the eye produces enough tear to keep it moist. So tear films are available which is kept on the eyes and studied. Electroneurography. Electroneurography may show a paralyzation or less conduction of the impulses in the affected side of the facial nerve. And Bell's palsy is classified as grade 1, grade 2, grade 3, 4, 5, and 6 based on the severity. Grade 1 is said to be a normal facial function, and mild dysfunction comes under grade 2, moderate dysfunction grade 3, and moderate to severe dysfunction comes under 4, severe dysfunction comes under grade 5, and total paralysis of the affected sites comes under grade 6. Coming into the treatment part of Bell's palsy, often is a self-limiting disorder. Gradually resolves in 80 to 90% of cases, often begins to resolve within 3 weeks. Recurrence of up to 8 to 12%. Prednisolone is used based on the severity to reduce the inflammation of the facial nerve and which is withdrawn gradually. Antiviral medications are needed if the cause is suspected as reactivation of the viruses. Some cases it may need surgery, especially in the where the 90% of the nerve degeneration is taken place. So by the compression and all. So in those cases it may need surgery based on the type of the lesion and where it is affected to reduce the facial nerve compression. And facial nerve grafting may be needed, and improper closing of the eye leads into dry eye syndrome. To overcome that problem, so we may go for tarsography. There are some exercises for the Bell's palsy. like expression and self massage. Expression like angry, smiling, puffing the cheeks, and pouting. These are the expressions which helps to improve the facial muscle strength. So that is angriness, smile looking, puffing of the cheeks, pouting. So these are the expressions. Coming to the self massage of the facial in a circular manner.
Start the massage from your forehead, and it should be in the circular manner, and care has to be taken. You should not only move the skin. So a gentle pressure has to be exerted on the underlying skin muscles also, and afterwards below the eye, and afterwards is a circular movement has to be done over the upper lip, and each circular movement means this circular movement has to be extended towards the adjacent ears. Then afterwards below the lower lip, and these circular movements has to be ended up with the towards the ear, and afterwards the cervical, this neck region has to be massaged.
Ayurvedic medicines used to treat Ardita. Shushruta says Ardita is limited only to the face, whereas some author says is some half part of the body. So Ardita can be easily correlated with the facial paralysis. The kashayas, that is decoctions used to treat the Ardita, are Mashapladi Kashayam, Rasonadi Kashayam, and churnas like Ashwagandha Churna, Kapikachu Churna, Voti, that is tablet like Ekanga Virasa, Rasonadi Vasa, or Voti, and Brahatvata Chintamani. And there are some common procedures are used to treat Ardita like Nasya, Abhyanga, Kavala, Karnapurna, and Shirobasti. So this is all about a brief introduction to the Bell's palsy. If you like this video, then kindly subscribe to our channel and press the bell icon. Thank you. Thanks for watching my video.